Hello everyone. Today I'm gonna talk about separation anxiety disorder. My name is Wei, and firstly I'm gonna tell you a myth. Separation anxiety only happens in very young children. How do you think so? It's quite common, but actually SAD can affect all age groups. Why I choose this topic? I choose this topic of separation anxiety disorder because I can know a lot about how to deal with crying during drop off. And this is very important challenge for both parents and children need to face each morning. And today I'm gonna compare these two articles. The first one is the separation anxiety disorder written by Mayo Clinical staff. The link is shown as below. And a second article is age by age symptoms of separation anxiety disorder and how to help your child, written by a doctor, a psychologist. The link is shown as below. And I will compare six different points. For the first article, the main idea is separation anxiety is a normal age. So as I usually work in a nursery in the very center community church, and almost all the infants cried at drop off. And for the second idea, I want to talk about this separation anxiety were improved by age 2 to 3. So one boy in our child care used to cry, but now that he's older, he chose to calm down and didn't show any cry at this moment. And the third idea is when to worry and the signs of disorder. If a child remains more upset than their peers for a long time, so maybe we should pay attention for this. It can be separation anxiety disorder, not just the typical behavior. Like my personal example, like a babysit named Anna consistently cried unless I held her. She needed distraction and constant physical contact. It was emotional exhausting and showed signs and deeper anxiety. And for the second article, the first main idea is separation anxiety starts around 8 months. So like my friend's baby didn't mind a stranger at 5 months, but by 8 months he cried when unfamiliar people helped him. And the second idea is when the baby passed age 2, there may be a signal for an issue to concern. As the children grow, they should begin to understand their parents will return. If they don't, or their anxiety increases, it may be the time to seek help. Like my example, a toddler in my daycare learned his mom would always come back. He stopped crying and asked for snacks and playtime instead. The third idea I want to talk about is the practical caregiver strategies. I will talking more about this in the conclusion. And the example is like in our daycare, we usually coach parents to say goodbye instead of just sneaking out. This will build trust and reduce stress for the child. In conclusion, separation anxiety is a normal stage for children under 2 years old. It may become a concern if the symptoms persist or continue after this age. This insight helped caregivers recognize symptoms between 8 months and 3 years old, especially for the Article 2, talking about the age group. Practical caregiver strategies include gradually increasing time apart, providing reassuring up reunification, pricing children for coping well with separation. If the child continues to struggle, it may be the time to seek professional help. So now I want to compare these two articles. Both articles are written by health professionals. However, the article 1 focuses more on medical science and when to see a doctor. It's written from a clinical perspective. But Article 2 focuses more on age-specific behavior and practical strategies from a child psychologist perspective. Personally, I really like Article 2 because it's very clear and then I know what is normal by age. It says separation anxiety starts around 8 months and usually improves by age 2, which helps me better understand child behavior. So in general, I would like to give you guys a big takeaway. Separation anxiety is normal in children under 2, but if it continues after age 2 or get worse, it may be a sign of separation anxiety disorder and professional help may be needed. And also for the caregivers, they can take some actions instead of do nothing else, like create regular goodbye routines and maybe just the kiss and say goodbye or stay kind and reassuring during separation. Also, encouraging playing and emotional expression a better way to do so. Watch for warning signs if anxiety continues past age 2. And how I will use this in my family childcare home. Like I will teach parents not to leave without saying goodbye and also help children find their favorite toy or play area will help them a lot. Encouraging parents to build short goodbye routines and also praise children. When they doing real well, we are doing very well. If a child shows strong anxiety past age 2, I will suggest the family talk to a child psychologist. So thank you for watching. Bye. Bye.